My name is Flavia Mwerwa. I'm 67 years old. I come from Zambia, Africa. I've been suffering from back pain for quite a long time. I've seen my doctors in Zambia who has been treating me with the analgesics. I met one surgeon, orthopedic surgeon, who recommended me for MRI. And I went to David Mwanawasa Hospital in Lusaka, where MRI was taken. It confirmed that I had a decompression of the spinal cord. So now it was a matter of looking for money to come here after the discussion, which we did. And then here I was referred to Dr. Rohan, who made necessary arrangements for me to come here in India so that my surgery could be carried out. I started off in Zambia on the 19th. By 20th, I was here. I was welcomed at the airport by Mr. Ratish. I felt at home because I had so many things thinking, how am I going to fit in the new place? But everything, God planned it in a nice way. We came here at the hospital. We were taken to the hospital lodge, where I was also welcomed very well. Then I met Mr. Rahu, the one who looks after the international patients. Very nice man, very cheerful. It looks as if we have met somewhere, and then this is the second time or the third time that we are meeting. I felt very much happy. I was at home. Then the following day, that was on the 21st, Mr. Rahul told us that by 9:30, I'll send transport so that you can meet your doctors, whom Dr. Rohan had already arranged or talked to. So Mr. Rahul came and sent the transport. The transport brought us here. He was waiting for us at the receiving bay. We went to the international lounge. All necessary documents were already prepared. Then we started our journey to see doctors. The first doctor that I saw was Dr. Krishna. My God. When I saw him, the reception that he gave me, my healing started. It looked as these people, I'd already met them sometime, then have come back for the second time or the third time. He asked me my previous history. I told him, and I gave him a disc, which he read, and then he explained what he saw and what he was going to do. I was very happy because he didn't hide anything. He said he would do his job, the rest would be to me. He examined me very well. He wrote things in the file, and then he said, you go and see the cardiovascular surgeon. And then from there, I went to see the cardiovascular surgeon with my Rahul. There again, when I just reached in his office, the reception that I received, it was just like, these people have already met them some time back. I was very, very happy because I was at home. He also examined me. He asked me questions about DBD, which I was diagnosed some 3 years back. And he told me to stop the drug which I was taking, aspirin. Then he would put me on an injection, other drugs. He also ordered his investigations. Then from there, the journey of investigation started. We went to the lab where my blood was taken and I submitted urine. From there, we went to the X-ray department where my lumbar spinal and the chest was taken. From there, we went to ultrasound where they did the Doppler for my legs. From there, we went to the neuro department where I was put the cuffs here and here and the feet. They were testing maybe they were testing the strength of my nerves, I don't know, but it was written neuro. They did their part. From there, we went to MRI. From there, we went to another department, which I cannot tell exactly, but I can tell you exactly what they did with me. They put 4 cuffs here and 4 cuffs here, 1 cuff here, 1 cuff here, as if they were taking blood pressure, which was in my thinking. Then they did it. Then from there, they told me to stand. They wanted to know the pressure. If I stand on one leg, they measure the pressure. I stand on the other leg, they measure the pressure, something like that. That's my own understanding. Then I had to sit down and start testing my feet to feel the cold and the heat. They wrote whatever they wrote. And then from there, where did we go? Then the anesthetist came to see me, who also asked me the same questions that I was being asked by my first surgeon and my cardiovascular doctor about my BP and if I'm diabetic and all that sort. Then I said, no, I'm hypotensive. I'm not a diabetic patient. Then that was fine. Then from there, we went to the admission place. I was told that in the evening. No, from there, we went home. The following day, Wednesday, I came to hear my results. I saw Dr. Krishna, who explained everything, and he took my x-ray, he put on the x-ray viewer so that I could see. He was pointing this and that and that. You have seen? I said, yes. Have you seen here? I said, yes. Fine. Then I'm going to work on this. Then from there, after seeing Dr. Krishna, we went to see my cardiovascular doctor. He wrote the medicine for me. And then we went home and I was told by 16 hours, I will be admitted. 16 hours, Mr. Rao sent the transport and I was admitted on the fourth floor, yes. In the evening, I was cannulated here. I was given everything that I was supposed to have in preparation for my operation. In the morning on Thursday, I had a shower. A new gown was given to me, and I was waiting for my surgery now. Then I was taken to theater. There, I met a lot of people. I was a bit nervous, but I prayed to my God. The way things started, that's the way the things should end. I was put in the preparation where they prepare patients for anesthesia. That's what I can call. But I saw a theater nurse the other side with a set. Anyway, we wouldn't ask, just look. Then from there, I was anesthetized. The anesthesia was so smooth that I didn't know what was going on. Very smooth. What happened there, I cannot tell you. It's only my surgeon. When I woke up, I just wanted to see my surgeon, that's all. I saw my surgeon, he says, here I am. I said, okay. Then I just said, I'm feeling cold and pain. I don't know how many hours I stayed in theater. The next time when I came, I found myself in the bed, in the ward. From there, I didn't feel the pain that I was feeling before. Or you see the pain which they say, when they operate you on bones, this is the pain that you are going to feel. Honestly speaking, I didn't feel that. The people here, they know how to work. Whatever they gave me to stop that pain, I don't know. It's for them. So I stayed in the ward Thursday, Friday, Saturday, Monday. The nurses would come and ask, are you feeling pain? No, it's the pain that you can bear, not a pain that you need the drug. Okay? But simply because things were written, they had to give me. I had no choice. And them, they had no choice. But I didn't feel that pain, which I would say, no, I was screaming or what. No, no, no. It was just a pain that you can bear also. Nurses were very good. The sister in charge, very good. Our friends who look after the floor and other things, they were very good. Catering, I wouldn't complain. They would come and ask, what do you want to eat? And my favorite was chapati with a bitter gourd. And you see, they did prepare that. I thought they won't, but they did. What else? I started physio on the ward. The following day on Friday, I walked a bit. Everything was there with a walker. Then in the afternoon, I was taken up in the physiotherapy department, where I started lifting my legs. You count up to 5. And then on Saturday, again, the physiotherapist came to my ward. We did a little bit of walking. And then in the afternoon, I had to go upstairs, where I did a bit of walking and lifting up legs. And then they started putting 1 kg, so that I can do like this. Sunday, it was a Sunday, they didn't work. Then Monday, I had my physio and I was discharged. So now I became an outpatient coming to the physio department. We continued that. The following Monday, they had to do the change of dressing in the emergency ward, while I continued also having my injection here. That continued until 2 weeks. Physio and injection continued. And in physio, they have done a lot of things for me to walk. I would push my walker in front, and then I would walk. I would push my walker in front, then I would walk. Then I would walk, we'll go around the physio, we'll go around, and then I start walking that, I don't know how I can call it. It has got 2 bars, and I have to walk at the middle. If I want to fall, at least this bar will hold me. I'll do exercises there. Then from there, I'll go on the couch. I'll lift up my leg and I'll do this, and I'll do deep breathing. Every day they were adding 1 exercise. Every day they were adding 1 exercise. Every day they were adding 1 exercise. At least I'm acquainted with those exercises. Even if I go home, those are the exercises that I'm going to do. I appreciate the work which they have done. The surgeon told me I'll do my part, and I have to do my part. Yes, I'm trying to do my part. You know, at my age, to start learning how to walk is very difficult. But I don't want to disappoint my surgeons or my people here. I want to show them that I can do whatever they have told me, unless otherwise. But I'm trying very hard. And I've made it. At least I've made it walking. Even if I'm not stable, but I can walk. I can walk. And tomorrow, I'm going to have my last physio. Today, I've been doing cycling, and tomorrow I'm going to cycle. I thank the management of Yashoda Hospital and everybody who was involved in my treatment, even those who were not involved in me. They were supporting me externally, and there were some who were supporting me internally. But on the whole, Yashoda Hospital, keep it up.
Hi, this is Dr. Vamsi Krishna Verma, Senior Consultant Spine Surgeon from Yashoda Hospital, Hyderabad. Recently, we got a patient from Zambia. This is a young lady who is 67-year-old. Her name is Flavia. She have traveled all the way from this African country, who is not able to walk from the past 3 years. She is wheelchair bound. It is difficult for her getting to her bathroom and do her daily activities. She has come to us with a solution. We have evaluated her clinically and radiologically. We have found that she has significant lumbar canal stenosis at 2 levels. for which we have explained her that she has this certain problem and this is the solution, for which she has agreed for the surgery. We have performed the surgery, we have decompressed her lumbar spine and stabilized it and fused the spine. Post surgery, the patient was very comfortable. We put her on some physiotherapy regime. She started walking in 3 days time using a walker, and now it's been 2 weeks post surgery and she's walking independently. She's using a stick for now, but as the time goes on, she's going to get back to her normal activities. Thank you.